You've been talking about how to fight pandemics for a long time. Your book, Deadliest Enemy, Our War Against Killer Germs, seen as somewhat prophetic during this period. But first, tell me about this Pfizer news that we've had this morning. To what extent, if at all, does that affect the work of a task force or an advisory group like the one that you're joining?
Well, I can't comment on the task force yet. That is work yet still to be done. I'm excited that it's happening and very supportive of its efforts. But let me just say on the vaccine itself, I think there have been a lot of conclusions drawn this morning that are premature. While the vaccine reported out 90% effectiveness or efficacy, that's a great finding. And we surely are very pleased with that. But what we don't know is that 90% of protecting against fever, cough, and chills, or is that 90% of effectiveness protecting against serious illness and death? And until we have those pieces of information, we can't really know how much of a game changer this really is. So we have to be very careful in interpreting this 90% number.
Yeah, and it sounds like that has a big impact potentially on the economy, what people can and can't do. Tell me the rates that you see of hospitalizations and how those are trending during this period when we've gotten better at treating COVID-19 and the rate of deaths. How much does that factor into the types of recommendations that make sense based on trying to, of course, take care of public health, but also keep the economy moving?
Yeah. Well, first of all, it's a false notion to keep the economy going versus COVID. When COVID is running out of control, the economy is going to be suffering mightily. So the things we have to do to get COVID under control will ultimately affect the economy in a positive way. Look no further than Asia. Asia, which has done a remarkable job of bringing these cases under control, and look what's happening to their economy. Let me take a step back and talk about the issue also you just raised about the number of deaths. What America has to understand is we are about to enter COVID hell. It is happening. 10 weeks ago, I made the prediction that after Labor Day, we would see astronomical increases in the number of cases. As you know, now we're talking about that very kind of issue, 120, 130,000 new cases a day, when at one point we were talking about 23 to 25,000 cases a day just weeks ago. This number is going to continue to increase substantially. We have not even come close to the peak. And as such, our hospitals are now being overrun. There's no other way to describe it. If you're out in the frontline battlefield, you'll see what's happening. The quality of care is going to drop precipitously when we don't have all the intensivists, the intensive care doctors and nurses and teams to be there. That's what brought us the much lower case fatality rates for the percentage of people who die. That's going to be challenged. And so you're going to see not just case numbers going up, number of people hospitalized going up, but you're going to see the case fatality rates also increase substantially. The next 3 to 4 months are going to be by far the darkest of the pandemic.
Yeah, we're seeing some stories even today, Doctor, about morgue capacity in El Paso. A lot of those western states now have cases per capita worse than New York saw in the spring. At the same time, though, we got a new mask mandate out of Utah and some dining restrictions out of New Jersey today. Are public officials at the state level reacting in time to make that dark picture a little less dark?
Well, first of all the cases that we are going to have for the next 3 weeks are basically already in the pipeline. If we had a miraculous change of behavior, we saw people not going into large crowds. We saw people not dining or eating out. We saw people not congregating in places like gyms and so forth. We would still have a major challenge on our hands. But what we're concerned about, particularly as we're going into the holiday season, where we're going to see lots of travel and bringing family units together from around the country. And by the way, transmission in our homes today is a very major source of transmission when you bring people in from the outside. And so I don't think America quite gets this yet. This is going to get much worse. This is not to scare people out of their wits. This is to scare people into their wits to understand that. Because we still have control. We can basically limit the contacts we have with people that will dramatically impact our risk of getting this disease. If not, everything I just laid out, the case numbers. I mean, we're going to look back one day and say to ourselves, oh my God, 100,000 cases a day? I wish we were back there at that point. So I think that's the challenge we have right now, is helping people see the future and knowing that they can do a tremendous amount about controlling that.
Shepard Smith here. Thanks for watching CNBC on YouTube.